All over the world, COVID-19 has disrupted life the way it was once known. Since the pandemic hit Namibia some 3 weeks ago, debate has been raging over whether concealing the identities of those who test positive for COVID-19 does more harm than good. The Health Ministry today dismissed these calls, reiterating that the ministry has an ethical obligation to uphold.
I would say we as the Ministry of Health, we have got an ethical obligation. With ethical obligation, we have to protect personal identifying information of patients who have come into our care. Not only for COVID, we have got a lot of people who have come into our hands, into our care, with a lot of medical ailment and health. We never reveal their identity. And from the epidemiological perspective, revealing the identity of a person like name or origin does not help in terms of containing the epidemic.
The ministry said its surveillance team continues to work around the clock to ensure successful contact tracing.
We do contact tracing. The surveillance team has got a responsibility to do contact tracing. And usually we start with the indexed case. The person who is in our care, who has tested positive. This is the person that we ask to list the people that they have been in contact with. And each of the person who have in contact with them will also enlist the people that have been in contact with them. That's how we get to the bottom of the chain. If there's somebody who will turn up and say, I was in contact with so-and-so has informed me that they tested positive, we will welcome them and register them. But we would not necessarily go to the public and say, so-and-so has tested positive, anybody who has been in contact. I think that will not go well in terms of containing an epidemic.
A number of people are quarantined at facilities across the country, with many released today after showing no symptoms over the prescribed 14-day period. More people are expected to be released tomorrow. Gordon Joseph, NBC News, Windhoek.